Welcome back to Rohrich Knose. Hi, I'm Rod Rohrich. I'm a board-certified plastic surgeon from Dallas, Texas, helping you become a better you. And today, let's talk about Simon Cowell. Everybody knows him from America's Got Talent, the creator of X Factor. He's an English television personality that really is pretty blunt when he's on TV about how he feels, and I like that. So the big talk about him recently was what's happened to him, and this was shown in a video clip that was from December, and basically it looks like he's had some fillers and neuromodulators and probably was a little bit out in public too early. So I just want to go through why I think people tend to pick on personalities that are famous, and yes, we all age. When you see someone like Simon in 1994, then you see him in 2001, of course we age. We live on planet Earth. That's normal. And when you're before the public eye, you get scrutinized more than anybody else. And really, it's his private life. Of course, we've all had Botox, we've had fillers. He's had Botox fillers. He's had some other things going on, including eyelid surgery and perhaps even a brow lift. And then he's had some reversals of all these things, and including the fillers, which I think he went through a period when he was actually doing a lot of fillers, and then he did all those things, which actually is pretty normal for our patients to go through. The key is, the most important thing, like for Simon, is that, sometimes, he probably perhaps had more filler than he wanted, or then he had it removed, and these are all things that happen to everyone that I see, almost everyone, especially when they don't have a injector that's going to say, hey, wait, that doesn't look good. Don't do that. And I tell my patients that all the time. I say, I know we just did a filler 3 months ago, but it looks good. Don't do any more, because I'd rather underdo and underfill than overfill, because that's when you look abnormal, you look strange, and you really want to make sure you maintain that natural look, and especially a TV personality. So I'm actually coming to his defense that he really, he's wanted to maintain his youthful, handsome look, and that's fine. I mean, he's even had, something called a silhouette thread lift that was, I guess, in 2018, and thread lifts, by and large, don't look good and they don't last long. They really are things that have no anatomic specific basis, because they're basically these little threads and barbs of suture that actually pull the skin up, but they don't act on the deep fascia. So it really doesn't look good long term, but it's simple to do, quick, easy. And then all these other things, fillers, Botox, getting your teeth whitened, these are all things that are fine to do. I mean, but I think sometimes as stars and personalities like Simon, they age. Of course, when we age and we gain and lose weight, guess what? Once we lose weight and we lose facial fat, it makes you look older. So the things that sometimes people will do when they lose a lot of weight is that they'll add a lot of facial fillers, and that's okay if you don't overdo it. I prefer in those patients to add facial fat, because I specifically add the fat where you've lost it, in your deep malar compartments, in your cheeks, in your temples. That's my preference, because you're replacing like with like. And there are fillers that you can do that actually can substitute for that are safe, as long as you don't overdo them. So I think that's fine to do. And I think that weight has a huge change in that. So when you lose weight, as Simon did in 2020, you can see that also aged his face. And so you can modulate that with filler application, as long as you don't overdo it. And I think that's one of the most important things is, moderation is just like a lot of things in life. Don't do too much, and that really helps you. And especially when you're talking about fillers and Botox and all of these things, just less is more, kind of a lighter touch. And even with surgery, in your early 30s, 40s, and 50s, less is more. And once you start needing it, then you can actually start doing more things like eyelid surgery, a facelift, and all those other things. So less is more with fillers, especially because if you overdo them, you look overdone and weird, and that's not a good look. That's not a good look at all. So when I look at what happened to Simon in that video in December of last year, I think it's a combination of things that he did with fillers and perhaps even a brow lift that actually gave him that really kind of overdone, but it looks like an early post-op swelling look. And I think that was probably a little bit early to get back on live TV. And you can see it's been dissolved somewhat and actually looks softer. And I think that's just really, I'm not necessarily coming to his defense more than saying that's really what you see a lot of, not only in Hollywood, but in the streets around major cities around the world, is that if they're seen early after they've had something done, now granted, sometimes they're overdone, it takes a long time for that to resolve. So the key is know before you go. And by and large, don't do things that will look really, really not good long term, and also that are not reversible, like overdone brow lifts or facial eyelid surgery, or even a facelift that actually is overdone and overpilled. That's really what makes you look really, really different. And you'd rather have a underdone look. I mean, a classic example of that is, Kenny Rogers. When you saw him, he was a good-looking guy, and then when he had some facial surgery, I mean, he really looked like somebody else, and you didn't even know really who he was until he sang. And so you really got to be careful when you're doing surgery and fillers to know before you go. So how do you know how to select someone that can give you the best result? I think it's really, you have to find a board-certified plastic surgeon that understands the entire spectrum of the science of aging and can do both the neuromodulators, the fillers, and surgery. And then you want to have them help you march through your aging process of your 30s, your 40s, and 50s and 60s. And this is really what we've seen in Simon, is that, he's a good-looking guy, and as he got older, he started doing the non-invasive things, the Botox, the neuromodulators, and he had some eyelid surgery and other things, and that's fine. But then there was some extreme times when probably was too much fillers done, and then those were removed, or you allow them to go away. That's a good thing. But find someone that can help modulate and underdo those things, especially when you're younger. If you underdo them when you're younger, you'll look better as you get older. And I think when you get to the stage of needing eyelid surgeries in their 40s and 50s, and then your facelift, then you can do that in a very natural looking manner so that you don't look overdone, windswept. Remember, as plastic surgeons, we're in the face protection, not witness protection program. We want people to recognize themselves in the morning and not frightening themselves or others. And I think that's really what you want to do. And sure, I'm sure that's what, famous people like Simon want as well. They don't want to look like somebody else. They want to look better, a more youthful you. And remember, we live on planet Earth, so gravity is our enemy, but the plastic surgeon is your friend. And that needs to be somebody that not only is board certified, but that truly understands what you need and what you don't need, would not overdo you, will not overfill you, and will really listen to what your concerns are and be able to outline exactly what will work and what won't work for you. So those are some of the cardinal rules that you should follow. And so I just brought up Simon just to show that this is what happens in the normal sequence of a famous person going through aging and really trying to look as good as they can be throughout their career. And I think I see that commonly all the time, not only in famous people, but I see it in a lot of my patients as they age. And the key is you have to find that person that will guide you to staying natural and youthful and looking as young as you feel. And when you do that, you've struck the gold mine. And I think That's hard to do, and it's beyond social media. It's beyond their website. It's listening and talking to that individual surgeon and saying, this is what I want. These are the things that I really think are important. And then listening to that experienced surgeon who really has the experience, the expertise to give you exceptional results. So it's 3 E's. And I think that is so important. And once you hear that, and you know when you interview that type of individual, you know you're in the right arena. And that's really what I do with a passion every day to my patients. I tell them, no, that's not really what you need now. These are other things you need, and you probably don't need anything right now. But that's a very important thing to know versus someone that's going to do more and more and more every time you come and see them. It reminds me of this famous story of a famous person that actually had 6 nasal surgeries in 7 years, but because he was so famous, the same surgeon kept doing the procedures on him because he thought that he would go elsewhere, and of course it turned out to be a lifelong devastating, nasal procedure in rhinoplasty. And so the key is the power of no is important from you as a surgeon to your patient, and they have to listen to you. And and I think, but once you have that bond and that trust and that relationship, you can really make it so that they need to know that you're on their side. You want them to be their best you. And I think they need to know it and feel it. And that's the relationship I like to have with my patients. They know when they see Dr. Rohrich, I'm not going to tell them anything that's not good for them, because I'm driven by their outcome, not by my outcome. Their results, not by what I think looks good, but what will look good on them. So know before you go is so, so important. So I'll leave you with that. Give me your comments and thoughts. See what you think about Simon. And really, I want to just say that these are normal things that happen. And I think that, the press can be very tough and mean to all of us. And really, I think that he's doing exactly what so many people have done, and I just actually applaud him for being brave and out there and actually saying, hey, this is me and this is who I want to be and I want to look as good as I feel. So I applaud you for that. So give me your comments and thoughts, and hopefully this will help you be a better you and a more educated you about feeling good about yourself, looking good, and finding the right individual to help you in this lifelong journey.